right, welcome everyone as you come into our Wednesday webinar. And as you arrive, we hope you take to the chat window and list who you are and where you're from today for our Wednesday webinar. We're really glad that you're here on this final Wednesday webinar of July. Hard to believe that July is almost over. There's something about pandemic that days seem endless, but months blur right by us. It just seems like time passes in such a strange way in pandemic. So we're glad that you're here, and please again post who you are and where you're from in the chat box over on the right. Make sure you change it, that little pop-up menu at the bottom of the chat window, change that from all panelists, you'll see it, and change it to all panelists and attendees. That way everyone else can see who you are. Thank you, thank you. Good to see Charles White, Shijong Shim, good to see you. Betty Cray from Aldersgate, good. Pastor Lee from Sparks. Allison Maki, we're glad you're here. Paul Filon from Lodi, good to see you, my friend. Wow, what a good crowd coming in. We're so glad that y'all are here today. It's good to see all of you, at least in text, and we will have opportunity, believe it or not, at some point to have you be seen face to face. We're excited about that coming in the near future. So, please, as you're arriving, we have a good number of attendees coming in. Post to the chat window who you are, where you're from. We like to know that and appreciate that you're here. All right, well, our team is all here today, and so let me get this moving there. There we go. All right, welcome. Hi, everyone. Craig Brown here, your Executive Director of Congregational Development for the annual conference. I'm really glad that you're here for this last Wednesday webinar of the month of July. And today's an important time for us. We're going to be discussing what I think is one of the most easily overlooked, but one of the most important topics that we need to address in the midst of pandemic. We're so thankful that Micheal is with us again to speak of that. I'm going to let Reggie introduce her in just a moment. But as you know, when we started these Wednesday webinars back in the very beginning of April, we started them as a way of helping each of our churches share some of their very best practices that they were discovering in pandemic. What we found is that some churches were really thinking about some innovative ways of collaborating and doing ministry in a really challenging time. And we had fantastic leaders, lay and clergy, that were just experimenting and doing some new things. And we wanted to find a platform, a way in which we could share that with one another, in which we could experience that together. And this has been a rich time in these Wednesday webinars over the last several months, and we have learned so much, both from our lay and clergy leaders from around the annual conference that have shared with us some of their very best practices. We've tackled some important topics, and there are still more topics to go. And one of the things that happened in the life of our annual conference over the last couple of months is that we have now brought on board Reginald Nichols, Reggie, our Director of Leadership Development. And the Wednesday webinar is really a leadership development effort to try to build up the leadership of our annual conference. And as I mentioned to you a couple of weeks ago, we're in a bit of a transition in our Wednesday webinar where I'm going to be kind of moving out of this sort of host role, and Reggie is going to be taking that role over and facilitating our Wednesday webinars. And so for all of you with us today, we just wanted to let you know that that transition was happening. I wanted to let you know that I'm still going to be around on the Wednesday webinars. I'll be lurking, and I may even blurt something out from time to time, as is my habit. So you'll have to forgive me for that in advance. That being said, I'm excited that Reggie is going to be able to provide some leadership. He's be able to provide some vision, some direction about where Wednesday webinars can go. We kind of created these Wednesday webinars with, as we say in my culture, spit and baling wire. We just kind of went real quick after something to try to get something out in the open for all of you as churches. And I'm really thankful for the team that we've gathered together. Tua Yang, our communications associate, our director of communications, Selby Ewing, and now Dr. Nichols, Reggie. We're so glad that they're going to carry this Wednesday webinar to its next iteration. And so you're going to start seeing some changes in the Wednesday webinar that I'm really excited about, and I think is really going to add to this time and build into your capacity to lead even in the midst of pandemic. So I'm really thrilled with the work that that this team has already done, and so thankful for Reggie's presence in our midst. we're glad that we got him here from Portland. He's now in Sacramento, and glad that he's here in our area. And Reggie, you're such a blessing, and we're really glad to have you with us. So I'm going to turn things over to you to lead us today and moving forward. And again, thanks to all of you for your participation in these Wednesday webinars. Let's keep up the good work as an annual conference. Great things are happening even in these difficult times in pandemic, and thanks be to God for that.
Good. Well, thank you, Craig. Thanks for your leadership and leadership of the team, and this opportunity to continue to do this important work. So I look forward to serving everyone in the conference as we continue our Wednesday webinar, and especially this exciting Wednesday webinar. So again, as Craig said, we're looking forward to I'll introduce our speaker and part of our panel today. Don't forget to put some questions in there. I'll be looking at some questions that we can take up toward the end of our time today. We'll also have resources for you that are available. We will be able to post those resources with links on the webinar webpage. And also, one of the things we're going to try to do today, we're going to keep our space open. We're going to end at 5:15, but we're going to keep the space open to 5:30 so that if people want to chat, they can. And as Craig said, in the future, we're going to look at how we can get a narthex moment where we can invite everybody into the space by face virtually, and so that people can see each other. So we're looking at those opportunities. But we want to give Micheal the time for this important topic. And so, as some of you know, I've been excited over the past 45 days to meet and learn from and talk to Micheal, our conference lay leader. And we're excited to have her talking about this very important topic, keeping our elders safe during this COVID-19 moment. So without any further ado, let us welcome our conference lay leader, Micheal Pope.
Thank you so much, Dr. Nichols. It's, I love you, California, Nevada conference. It's always my honor and privilege to come and be with you. And it's always my honor to talk about seniors and elders, because that is what I do when I am not doing the business or being among all of you. As you know, I am the CEO of Alzheimer's Services of the East Bay, lovingly known as ASEB here in the Bay Area. And we are a nonprofit that serves elders, and we have been serving them for 31 years in this area. We were actually started by members of the First Congregational Church of Berkeley, which is right across the street from my office. So we have a faith-based beginning, even though we are not a faith-based organization. And our primary focus is to work with both the caregiver, the family, and the individual who is living with Alzheimer's. In the last 22 years of my tenure here, we have expanded that to go into mental health and other areas where people are having cognitive disabilities. So I come to you with that understanding, and I'm going to share my screen with you because I do have a PowerPoint to take us through this conversation. But please, as Dr. Nichols said, please use the chat to put any questions that you have down. Know after if there's anything that you want to follow up with me, you know how to reach me. It's Micheal, M-I-C-H-E-A-L @aseb.org. And I'm just so excited. I saw some names come up of people that I have not seen or heard from in a long time. It's a blessing to know that you're out there in this virtual audience. So let me bring up my share screen, and as I used to say back in the day, let's get this party started. All right. Let me do it from here. All right. So keeping our elders safe. When we're talking about elders and seniors across the world, we're talking about individuals, usually in the United States, we're talking about people over the age of 65. But as you well know, that is not a universal sort of number or age. 55 to 65 is what we look at as the beginning of seniorhood, and then 65 and over, again, based on retirement age and the ability to collect Social Security. We look at that age as the beginning of seniorhood in the way that you probably are used to it. As we have learned over the last decade, we have more and more people living longer. And so by 2050, we have noted that 22% of the world's population will be over the age of 65. And we have learned that 2/3 of these individuals will live within city limits. And so as you're listening to this presentation, think about where your church is. Where is it located in any community? Where is it within the city limits? And know that your elders, particularly if they do not have family, which is another growing segment of our older population of people who do not have children and do not have family members that can care for them, the majority of those individuals will move into a city. And the reason they do that is because of the resources that are available in the city, like transportation, housing, hospitals, and all the things that they need in order to survive. And sometimes the more rural communities, those things are further apart from the housing places where people actually have been aging in place. So I thought it was interesting that 2/3 means 1.6 billion people worldwide will be over the age of 65. For the first time in the history of our world, because of the baby boomers, we are actually, there's more elders than there are children over the age of 5. And so we are a country and a world that is aging, and many of us are aging in place, and we're aging differently than some of our ancestors because of medical interventions. We're eating better, exercising more. Cognition is becoming, I'm sure you guys can see on television, there's all these cognition drugs and things that people are pushing at people at the age of 50 and up. And so we as a congregation and we as people of the Cal Nevada Conference have to begin to think about, what does that mean not only to our congregations, what does that mean to the services that we provide in our churches? How do we give access to those individuals? I know for me, as I've gotten older, I now have cataracts. They're not big enough, as the doctor told me, for them to go in and perform the surgery, but it is affecting my vision. And so the reality is all these things come into play. The fact that our skin gets thinner, elders bruise quicker. So a lot of times I work with APS, Adult Protection Services. We'll get calls and family members, we go in to do a check and the family member said, I just touched mom. And you know, 80% of the time that's true. We do have about 25% of the cases that we see, there is some family neglect or harm being done, but the majority of the time it's because the skin is thinner, the bone mass changes, and that's why you keep hearing folks say, go and lift weights, because the more you can lift weights and the more bone mass you have, core strength you have, back strength you have, the risk of you being prematurely having to use a walker or wheelchair or cane, you diminish that. So 2/3 are going to be living in our city limits. That's a pondering for you. All of our seniors under COVID-19, we now know are at higher risk than any other segment of our population. 8 out of the 10 individuals that were diagnosed with COVID-19, these individuals did pass away. And so we know that not to be the same for our 20-somethings and 30-somethings. While they did get deathly ill, the number of individuals that passed away from this diagnosis under the age of 65 does not match what has happened to our elders. And again, for all the reasons, upper respiratory, what we call COPD, asthma, heart disease, high blood pressure, diabetes, all of these secondary diagnoses create a space where individuals who are over the age of 65, it affects their immunity, and anything that affects the immune system makes you more vulnerable to something like COVID-19. So that's something to remember. Particularly, I know for me, being in my 60s, I'm very aware of my environment and who I'm around, especially because I live with Generation Z. So I have to be careful when I'm around her and her friends. Some of the symptoms, I think it's important to talk about the symptoms because they are a little different when it comes to a senior. Seniors will either spike a temperature or all of a sudden have chills, or both at the same time. There's a dry cough with some there is no cough at all. Shortness of breath, we are seeing quite a number of our folks having shortness of breath or difficulty breathing. Fatigue is a real big one that we're seeing in our seniors, that they keep saying, I'm just so tired. My muscles ache, my body aches. And then at that point, we have to do an assessment to determine, is it arthritis? Is it something else? Or is it really one of the symptoms of COVID? Headache, loss of taste or smell is really prevalent among our seniors. A sore throat, cold-like symptoms with a runny nose, nausea, vomiting, and diarrhea. The cold symptom thing is really interesting here in California. In Alameda County, where I serve, we are having people running in over the last 2 weeks to get their COVID testing because they have cold-like symptoms, but they're forgetting that they also have allergies. And without all of these other things happening, we are really advising people, unless you can see 2 to 3 or more symptoms, kind of take a minute to take a look at that. If it's a fever, absolutely. If it's a fever coupled, with the loss of taste or smell, absolutely. But if you just have a runny nose and nothing else, you may be going through an allergy time. Pollen is really high right now, and I know that I'm experiencing it, as well as some of the seniors that I'm caring for. The emergency, though, I want to bring up when to call 911 or when to get your loved one to the hospital if they are having any trouble breathing. So breathing in an elder is similar to a baby. I don't know if you've ever paid attention. I know I did. Looking at babies, babies breathe very shallow. And so it's a quick breathing. Their little chests go in and out, and seniors have a tendency to breathe the same way. And so we want to look and see if there's any pressure or pain when they're breathing on their chest cavity, but also in their back. Do you ever wonder why the doctor is taking the stethoscope and putting it on your back? It's because your lungs, that's where we hear your lungs. And so if there's pressure in the chest, pressure on the back, or if they're coughing and they say it hurts in either area, that is a good reason to call your primary care physician and get an appointment to take your loved one in. Because I work with individuals with cognitive disabilities, dementia, Alzheimer's, we know almost right away when our patients are sick, because what will happen is they become more confused. So we do a thing called a mini mental score, and the mini mental score is from 1 to 30. And so what we will do is sit down with that individual to figure out if their mini mental score has moved in any significant way within a very short period of time. And if most of them are in single digits, so most of us are probably high up, 29, 30, I hope, but our seniors are not. And so if their mini mental score diminishes in any way, a significant diminish along with these other things, then, and again, how would you test that? If your loved one or the loved ones that we're serving all of a sudden don't know who they are, don't know the name of the church, don't know their address, don't know what day of the week, the time of day, they are confused and there's something going on. It doesn't have to be COVID because again, bladder infections, any kind of infection will do this to an elder. An inability to wake a person up or for them to stay awake. And what that means is not that they're not awake, but they can't open their eyes. They're unable to converse with you. They're slurring. Lots of times they will be drooling a little bit. They're cocking their head to the side or holding it down. That's an inability to wake or stay awake. And anytime, whether it's COVID-19 or anything else, if you ever see anyone whose lips are bluish or their nail beds lose color, something's going on. It may just be an oxygen decline, but let's get them in, and better safe than sorry. That's what I always tell my clients. It's better to take your loved one into the emergency room for them to tell you we can't find anything wrong than to wait for that moment when a person is gasping for air and you don't have oxygen around to help them. Most of our churches, I believe, back in, I think a decade ago, we got defibrillators and things in our churches. And that's a really good investment if we don't have them, because you just never know with heat and different things, elders, react differently to these environmental things. During COVID-19, the thing that I'm hearing the most from our seniors, so that you know what I'm referring to, the Department of Public Health and the Department of Aging and the Department of Health for Seniors we're making telephonic calls to, I have 140 patients, and so we are calling 140 patients every single day to find out how their caregiver is doing, how they are doing. And what I am realizing in this is the social participation is really hurting the seniors who have been sheltering in place since March. Many of them have not been out of their homes, and the only social participation that they have had is with their family members. And now, while that's wonderful and good, we all know we need more than that. So if there's anything that we can do, if you own a van that you can go by, we've been doing this, we call them drive-by visits. And so 3 or 4 of us will get in a van, one of our ACEP vans, and just drive by and wave to our participants from the door. Their family members sometimes will bring them out in a folding chair on the sidewalk, and we'll just go by and wave and say, how you doing? And the other day we sang happy birthday. So finding ways that we can bring back leisure and social connection. Culturally, many families of different ethnicities will say, well, I don't want that call, or I don't need any help. But I'm here to tell you, the minute that one of my staff member calls them, they're on the phone for 40 minutes talking to them. And around the Bay Area, we do have what we call telephonic senior centers. And so those senior centers are now calling seniors that were on their roster for family activities and to connect with them. And then spiritually, I just had a phone call with our 90, I think she's 98 or 99, one of the members of our church. And I just read, some of the Psalms to her. And she was so happy for that moment. So any of those social participation things that you can bring to the life of the people of your church or the people in your community, I really beg you to do so, because the one thing that happens with seniors, the same as with a baby, when babies are born, we swaddle them and put them under the warm lamp and give them to their mom and dad to hold so that they can thrive. Babies that we can't do that with, and we call it failure to thrive. Well, the same thing happens with seniors. Since March, 9 of my patients have died. And 9 of them, yes, they ended up with COVID, but they were beginning to shut down prior to the COVID diagnoses because of the lack of connection with their community. So this is really important during this time and also in the days when we don't have COVID. Respect and social inclusion. I think this is the most important thing that we could teach our future generations. How do we include family, community, and faith-based communities and service providers around our elders, around our seniors, so that they're engaged? I chose this picture on purpose because there's an elder with 2 little children. And I advocated in Sacramento once for some money, and I said to our governor, who was Governor Brown at that time, and I said to him, I said, Governor Brown, what a baby that is born today is going to be a senior some point through the grace of God if they have the opportunity to live. So are you telling me the investment that you're willing to put in the life of a child, you're not willing to put the same investment in that same child who now is at 90 years old? And he was speechless. So that's the connection that we have to make, that just because I'm no longer a child, I was a child once, and the same needs that those 2 little people have in the photo, that woman has as well. And they're laughing and giggling probably about the very same thing. So family, community, faith-based communities, and service providers, this is my dream, coming together and really making an impact, not just in our ministries, on our church campuses, but in our communities and in our neighborhoods. Communication and information. I want to thank Selby Ewing and Tua for everything that they are doing with our website, everything. They've taken the fonts up, they've made the colors, things that you can see as an elder. Certain colors elders don't see anymore. They disappear. We changed all of our signage in our building, and it's now green and white. You'll notice that the fonts in this presentation are white, because the reality is the older we get, colors start to meld together, and the more distinctive that we can make those colors when we're communicating with our seniors, the better. But information and social inclusivity is so important, and connecting with our elders in a way. Yes, snail mail is best for them. Many of them still have flip phones, and I'm finding even those that have smartphones, they have not yet learned how to use all of the multitude of applications and all of that. I have to say, I don't either. So whenever I'm in need of help, of how to use my phone, my laptop, my Zoom, anything, I actually call on my daughter. So this is another challenge to all of you out there. This is a way to connect some of our young people with our elders. I dream of the day that every elder in our church is connected to a younger person so that they can learn from each other. In Belgium, in the Netherlands, one of my favorite places for elderhood, that is what they do. If you want to go to college now in the Netherlands and you don't have money and you want to move into a senior care facility and partner with an elder, the Netherlands will pay for your university education. You have to commit to it, of course, and you have to be there to support that person. But what an incredible concept. I'm pushing that for the United States. We're a little less progressive in that way, but staying linked to people and events, and younger people, not that age groups and peer groups aren't necessary, because I don't want you to hear that, but I'm just telling you, if you would see the preschool kids come into this building and those folks downstairs that are 80, 90, and 100 years old, how they light up, because the expectation of the children is not the same as if it's peer-to-peer or daughter to mother, or however that relationship. They just come in and just see seniors, and they see grandmas and grandpas, and that's all they care about. So let's link them and keep them engaged and involved. I've put together some resources for you because I think it's really important right now during COVID-19. What we are studying here in Alameda County is that we're realizing that there are a lot of individuals that are over the age of 65 that are not getting food. And the reason that is because they are in low income neighborhoods and they live in food deserts where there are no major grocery stores or places where they can buy organic or fresh foods. Particularly in the Oakland area, we're experiencing more and more of our seniors are living on the street. And so Meals on Wheels and Feeding America are two phenomenal programs that just need a zip code, and they will make sure that those individuals get food. Meals on Wheels now is also using one of our vans to go out into the community and search for homeless folks over the age of 65 so they can be fed. Paying their bills. This is a big deal right now. Many of our folks that are over the age of 65 may not have retirement. They may be living off of a very small pension because they lost their pension dollars when the market fell, and they're living off of Social Security. Anyone who knows that Social Security does not get an increase on the level that it should. And the, what do I want to call it? The poverty quotient that was set to determine the Social Security rates, that quotient hasn't been changed for over 2 decades. And so we're fighting in Washington, D.C. now through AARP. I'm a member of the AARP task force to talk about raising those rates so that people can live, particularly in a state like California, where the average rent is $2,000 to $3,000, even in some of the senior homes. They will also help with utility bills, prescription drugs, and more. So these are really good resources. And as Dr. Nichols said, this information will be put on the website for you to use it in the future. Also, Medicare and Medi-Cal, and what does this mean, and what is a Medi-Medi, and what is managed care? So let me explain. Medi-Cal in the state of California was the Medicaid system, and like everything else when I moved to California, California took it and called it Medi-Cal, and changed it, added more dollars to it, able to pull down more federal dollars. But then 5 years ago, what the state, again, under Jerry Brown, decided was that Medi-Cal was eating up too much of the money, the budget. And so Medi-Cal partnered with managed care. Managed care are your providers like Alameda Alliance, Kaiser, Blue Cross, Blue Shield, all these different groups now, they're managed care. And what that means is they get a capitated rate for every individual that they serve over the age of 65. So what does that mean? If the capitated rate for that individual is $100, I'm going to use that just as an example, and my service is $25. So they'll take that out of that. And then their prescriptions is another $50. So they'll take it out of that. And then a doctor visit is $50. So that's their capitated rate. Once they go over their capitated rate, they have a thing that's called fee for service, and they have to pay into whatever that amount is over the capitated rate. And so you will hear a lot of families saying, oh my gosh, my share of costs went from $200 to $3,000. And that's because the cost of their care went up over a year. And that's how they go back and assess it and do the insurance actuaries. And because we're living longer, you will find that your insurance policies will not cover as much. Alzheimer's used to be covered in every single long-term care insurance policy, and it has been dropped. And there's not many, unless you've already been grandfathered in, that will cover Alzheimer's and long-term care around Alzheimer's. Then we have the Senior Medicare Patrol. They are the Medicare pays for your hospital stays, your rehab stays, and it's really important because Medicare does cover it. So you need to know what they do cover if you're Medi-Medi or that you're Medicare eligible. Your legal services, there's always in every single community, there's legal services for seniors, and they are incredible. They're called HICAP. Every community has one because it's a federal mandated program. Any of these questions, get on the phone, call HICAP. They have retired attorneys and all kinds of folks, volunteers to help you navigate all of these healthcare things. It is a mess. Our healthcare system is a mess. And so we're working on it. So pray for that. If anyone is in distress, depression is high in our seniors and unfortunately is going untreated in our seniors. And many, many times the reason that it's going untreated because the baby boomers make up the majority of our senior population right now. And baby boomers were taught not to say how they felt. Baby boomers were taught not to go out into the world and say, I'm depressed. And so our seniors are living with undiagnosed depression. So if in your communities, you find that there are seniors that need your help, particularly after disaster, there's a disaster distress hotline, there's the National Suicide Prevention Lifeline. You can always call APS and ask for an elder check, and they will go, not in a mean way or a bad way, and check on that individual to make sure they're okay. I will tell you what you will notice in an elder that is depressed. If they are an elder that did their hair, did their nails, came out of the house a certain way, and that's off, and that's not happening from them, that is clearly a sign of depression. And so getting to them as quickly as possible is very necessary, particularly if they're administering their own drugs, which many of our folks are, and they're administering multiple types of drugs that could kill them very easily if, in fact, that was their decision to do that. So let's help our seniors as they shelter in place. The elder care locator is fantastic. If you know an elder in your community that needs transportation, every community has a paratransit system. It's sometimes good, sometimes bad, but the reality, it can get people to doctor's appointments and really assist them as they're trying to navigate without being able to drive. And we would not advise that any senior, until we are in a different phase of COVID-19, get on BART or any public transportation at this time. Those are very unsafe environments. Also, you know, one of I just had a conversation with the executive director of SAGE, and one of the most invisible senior populations in the world is our LGBTQ. And so the SAGE hotline is really important for connecting with our communities, our brothers and sisters from the LGBTQIA community, and they have different programs around medications and all of those kinds of things. SAGE is an incredible website, and so put it in your history so that you can access it. There's a coalition to end social isolation and loneliness. There's the distress hotline, the friendship line from the Institute on Aging. This should become everybody's best friend. The Institute on Aging, write that down. If you go to their website, they have free information about exercise. They have PDFs on all kinds of things, dementia, everything. We rob them all the time of their PDFs to work with our families and support groups. So keep that in mind. The Institute on Aging is amazing. The National Alliance on Mental Illness, physical activity, all of these different programs, and then our veterans. I can't lift them up more to you. Our veterans right now are suffering in our communities. One, because the veterans approval system for care is very, very bad, and they're working on it. It's my colleagues at the VA are incredible. They're working on it, but the system is so big and so antiquated that the time that it takes for them to process an application and then get back to that family to say, yes, you're approved for this service or that service. Please tell your veterans they are all able to get in-home services. It is a part of the plan for any veteran. And then many of our veterans are living with PTSD that looks like Alzheimer's, that looks like dementia. and they really need our help and support. So next steps, you know, as I was talking to Dr. Nichols and Selby yesterday and preparing for this time with you, and again, I'm so thankful to be able to share what I know best. This is outside of my love for God, this is the second thing that I know best, is to say to you, in your church communities, how can we organize an age-friendly task force within our congregations, with our laity, clergy, bringing in outside people? The reason I say that is because unless we really talk about our communities becoming age-friendly, we will never get to a place where future generations of elders will get the services that they need. I will let you know in this part of California, San Mateo was the first county to become an age-friendly county recognized by the World Health Organization, and I was so proud to be a part of that. Now, Alameda County, our Board of Supervisors voted probably before the pandemic. We did a proposal, and now Alameda County is an age-friendly county recognized by the World Health Organization. So what can we do to make your counties age-friendly? What will that mean? It will mean your signs will get bigger so that people can see them. There'll be more lighting on your streets so that people can see and navigate their community at night. The sidewalks will be wider so that an elder can walk side by side with another person. And in those areas, those rural areas, because I used to live in an area like that, there was no sidewalk. We fought and we got a sidewalk put in so that seniors can get out of their houses and navigate. Bad sidewalks means seniors are stuck in their homes. How do we do the assessment of our community to determine whether or not our community is friendly to age-friendly? Have some focus groups, do some surveys online and look at the demographics of your community and call your area agency on aging. Every community is mandated to have an area agency on aging. It is, again, the Older Americans Act. We can thank President Clinton for that. That is a great, great act. And what it does is protects the rights of our aged. And it says, if you take something away that's going to not benefit the life of the seniors in that community, you have to replace it with something comparable. And that is so important for you to know as you're navigating your voting power and you're living in the communities that you live. Develop some projects that you can bring seniors out into the, again, right now, COVID-19 is really preventing a lot of this face-to-face things, but maybe there's some projects that you can work on or that you can send to some of your church members and give it to them to volunteer. When we get to the Q&A, I will show you a couple of the packets. We call them activity packets that we have put together similarly as some of you are doing for your young people, for the little folks. Well, we're putting them together for our seniors and delivering them. Once a week, we deliver 140 activity packets for our seniors so that they can remain engaged and involved. So you might want to think about doing things like that. Partner with community-based organizations. No, they're not. Many of them are not faith-based organizations, but as a community-based organizer and as a community-based leader, I'm telling you, if it were not for the faith-based community that supports me throughout all my work, I wouldn't be able to do half of the things that I do. When we went out and said we needed masks, it was the First Congregational Church across the street that delivered 140 masks here so that we could take 140 masks out into the community. Don't be afraid of them. Talk to them. They want to partner with you as well. Your district superintendents, I mean, they are a wealth of information to us all, and partnering with them and letting them know more about what's going on the ground in your communities is so important. We need to know. I just had a conversation with our bishop discussing Alameda County, where I went to our Board of Supervisors and our Area Agency on Aging, and I said to them, you write all these policies, but when was the last time you walked the neighborhood and had a conversation with a senior? So Keith Carson took me up on it. Board Supervisor Carson took me up on it. And out in the community, he and I went through the Oakland community, East Oakland, down all of these streets. And we just stopped and talked to every senior that we could meet. So partner with your leadership. Partner within your community, partner within your conference. If there's something cool going on that you're already doing, let Salvi and Tua know so we can put it on the website so these best practices can be shared. We don't have to reinvent the wheel. There's so many of you out there who I have met during my time as your conference lay leader. You are brilliant, smart, and wonderful. Share that throughout the conference and then be innovative. Have those light bulb moments. One of those light bulb moments may be, why not explore beginning a health ministry that includes conversation around how do we help our elders? How do we help our children? How do we just have a health ministry that speaks to the disparities in our community around access to health? UCSF is an incredible university that I have the honor of partnering with on many, many research projects. And I know that DS Current said to me yesterday that they have money and funds that they might want to be helping churches do health ministry. I know the San Francisco Foundation has an arm that provides funding for churches that want to do health ministry. And even within our own connectional church, discipleship ministry, has a whole thing on health ministry. We can do these things together. We don't have to sit back and complain about what's not happening in our community. We can be a force to be reckoned with in our faith when we take on some of these roles. So I'm going to stop sharing. And I'm going to tell you, lastly, being a senior, I'm now a senior. And Kaiser told me during my last visit how fortunate I was that I was not physically aging rapidly. And I think they thought that was a compliment. But because I have a grandmother, or had a grandmother that lived to be 100 and something years old, the reality is, to me, aging is a joy. I love aging. I chose it as a field because I love it. And I love what happens to elders as they age, that calm that they have, that wisdom that they can share. And we have an opportunity within our conference, because we do have a lot of elders, to learn from them, to partner with them, and to be the best we can be with them. So thank you all for joining us today for this wonderful gathering. And I hope that I have shared stuff with you that will help you to think differently within your community, and as you age in place, to demand certain things within your context. So God bless you. I give it back to you, Dr. Nichols.
Well, thanks, Michelle, for the wonderful presentation. There are a couple of questions that did come up I want to ask you about. And while we're doing that, those of you that are on the chat, if you can put in some of the ways that, some ideas that you have that have worked for you in your community, in your congregation, you can put in the chat some helpful ideas for working with seniors, especially during this COVID moment. Why don't you put it in the chat, and let's share the wealth with everyone, okay? Michelle, thank you again. One of the questions that came up, especially as you're working with seniors, a question came up from Becky about, do you have any ideas of how to convince seniors to wear a mask around their caregivers? I've noticed that, as I've moved around, that a lot of seniors are reticent to wear masks, especially around caregivers. We just bought a home from a 90-year-old veteran, and while I went into the home, he was there, and he didn't want to wear a mask. And I wore a mask to protect him, but he didn't want to. So any ideas about how to do that?
Yeah, it's really difficult. I will tell you, it is difficult for a senior to wear a mask. And again, it goes back to their breathing capacity. And also, if they have any cognition decline at all, whether it's diagnosed or not, the mask feels like somebody is trying to choke them. And so they do not like the mask. And so what I normally say to our clients here, and I tease, again, remember humor always, because seniors also don't want to be told what to do by all you young folks, you know? So what I usually say to them, oh, Miss Jones, I'm putting on this mask because I want to protect you. You got to stay healthy and get out there and show us all what to do. And why don't you put your mask on with me? So together we put it on. And then if the person is not willing to put the mask on, then it's almost the same as working with a young person. Then I say to them, I have to maintain my social distancing from you. I have to move further apart from you. So it's not going to be 6 feet, it's going to be 10 feet. Your ability to hear me is going to be diminished. And so let's work together on this. And I have walked out of 2 homes since March where the family refused to put on a mask. And after a week or so, they called me back and said, we really need you to come in. We need some help. I said, are you willing to wear your mask? And they said, yes. And so at the end of the day, sometimes we have to just step out of the situation. Many times my social workers have to do that in order to get people to understand the seriousness of this, as well as you have to know that many of our seniors are home and they're listening to the news. And I'm not going to get political on you, but the reality is they're hearing that they don't need the mask and that it's all of us that want them to wear it. So, you know, use humor, use, you know, any kind of pictures or things that you can use, but do find out whether or not they can breathe first, because many times it is because they cannot breathe. And then I want to show you. So this is an activity kit, okay? So in the activity kit, again, we use plastic bags because then we can sanitize them with hand sanitizer. In this is a whole thing on how to stop the spread. This is the do's and don'ts that talks about putting on your mask. This is for the caregiver. This is bubbles so that they can go outside and blow bubbles. This seems premature to a lot of people, but you have no idea. I love bubbles. And just being able to go outside. Puzzles, there's puzzle pieces in here that there's a card in here and it says, I love you to pieces. And the puzzle pieces, we put a glue stick on it so they can glue the puzzle pieces on here and then give it to their caregiver. So there's all these kinds of things that you can do to help the person stay engaged. Seniors get ornery. I'm gonna tell you when they get ornery. They get ornery when they feel misplaced. If they feel like they're engaged and involved and that people really care about them and they're gonna be there for them, they will have a tendency to be a little easier to work with. But you have to understand, nobody lives to be, I tell my social workers and my staff, I have a staff of almost 100 people, I tell them all the time, nobody waited to be 70 and 80 and 90 years old for you to get your degree and to come in and tell them what to do. So it has to be more of a suggestion. And how can we do this together? Micheal, how can we do this together? Because, you know, they've got this COVID-19 thing going on and neither one of us want to get sick. So how can we work on this together? And that's different than saying, put your mask on. Just saying.
There's a question that came up, Micheal, about the COVID flyers for the kits. How can we, is it possible to get those things? I know it'd be a great activity for congregations and/or to engage congregations in creating these activity kits.
Yes.
Some of the flyers that we could put that as a resource where someone can download and print them?
CDC, the CDC has all the flyers, all those posters came from the CDC, and they have them in about 16, 17 different languages. So go on the CDC website and go under the section that says flyers and materials that you can print, And you can do it 11 by 17. You can make big posters or small paper. And again, in many, many languages. Tagalog I saw, Korean, Spanish. So that's where you go.
So we'll make sure everyone that's attending, we'll make sure that we put a link in the chat and on the webinar page for the CDC, so you can get the, Charles, you're on it. Thank you, Charles, for putting, you already did it. So thanks, Charles. I really, really appreciate that. And thank you for putting the other website information up also, Charles. I appreciate it. Finally, Micheal, are there any nuances for those that live in the rural areas where in the information, are there any nuances or any special things that we need to attend to relative to seniors and COVID and food and all of that sort of stuff? For those that live miles apart from anyone, is there something that you would suggest?
My biggest suggestion right now, and I'm advocating for this, is to get a hold of your local internet providers for your communities and begin to bombard their offices with letters to increase the bandwidth in the rural areas so that people can be engaged and involved. The Ombudsman group here in the Bay Area, what we're doing is collecting tablets and making sure that we're going and getting tablets to seniors that don't have tablets, because again, in a disaster, the way that we're going to communicate with people is over the internet and over the phone lines. And so anything that you can do to help to shame, I'm going to call it what it is, because that's what we did here. We shamed Comcast. And so Comcast came into Oakland, a certain section of Oakland, and provided free internet service for a section of Oakland that did not have any ability to pay for it. And a group of us wrote letters, and Nancy Skinner, Senator Skinner, helped us to do that. And now Comcast has gone over there and made sure that those folks have internet. So get engaged in that way. Make sure that people have the systems that they need to connect out, because it is scary to be in a community where you have no access to any information other than the television.
Got it. That's very helpful.
Yeah.
That's very helpful. We had a senior in Portland who turned 100, and she's at a assisted living center. And we did the parade and drive-by, which you suggested, which you recommended. And it was very helpful because all the other seniors came out, even at social distance, but came out to celebrate. But we saw her through the window, had big banners. I like what you said about the writing and the size of the fonts, and the colors of the fonts, and the colors of things are very important.
Yeah.
So any other final things? I appreciate everybody putting the suggestions. Becky loved the bubbles idea. Bubbles are very good, by the way.
Well, and what you're always trying to do is create a place of you're trying to level the playing field where you can have a conversation with the individual. And so bubbles, or we do laundry here where we bring shirts in and we rip all the buttons. So my son, when all of his shirts that he left at my house, we brought them in, we took all the buttons off, and then we gave them to our seniors to sew the buttons back on. Then we and they loved it. These women loved it, and one of our men, and they ironed them. Then we wrapped them, and we took them on a field trip to a one of those places where they resell clothing, and they donated it. So again, we can't just keep them in the house and sequester them away. In the Dr. Nichols, a senior said to me, she's now passed away, and a social worker said to me, she needs to be in a senior center because she's old and her bedroom is upstairs in her house and she lives all by herself with her dog. And I was called in as an ombudsman because she called to complain. I went in, I moved her bedroom downstairs. She wanted a little glass of port every night before she went to bed. So we got rid of the sleeping pills, let her have that little nip of port every single night. She was 90-something years old. And everybody was like, oh, she's gonna be an alcoholic. At 90 years old, she is not gonna be an alcoholic. It helped her to rest. She never went upstairs any after we moved her bedroom downstairs. And she passed away in her home. Yeah. So at the end of the day, we don't have enough facilities to put people away. I'm just gonna tell you, unless you're gonna move them way out of the way from their families. So let's make it so people can age in place and possibly die in their homes, because that's really what everybody wants.
Yes, 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 yes. Well, thank you again, Micheal, for this wonderful presentation. Again, we're going to have the presentation available on our website and the webinar page. I appreciate everybody coming together. And thank you for all that you're doing, Micheal, to make a difference in the world for our seniors and for other people. I wanted to see, check in with Selby to see if there are any announcements, and then we'll just talk about a couple of things, and then we'll talk about a couple of things, see if there are any more questions. And then again, as I mentioned, we're going to keep the room open for those that just want to chat along the way. So Selby.
Hi folks, and thanks Dr. Nichols. Hey Shell, what a great presentation. That was fantastic.
Don't ask me to talk about my seniors. I can do that.
The last story, I could feel it starting. I said, oh gosh, she's going there. So
I was going.
Go. It was fantastic to listen to. And so I would just put in my normal plug, but I will this week say thank you so much. So many of you have heard my plea for stories about your church, for stories about the ministries that are ongoing when the church is closed, the building is closed. So I am so excited, and you have to, if you don't subscribe to Instant Connection, please subscribe. And you'll find a subscription form on the front page and most pages of our website, cnumc.org. So follow us on Facebook and be friends with us on Twitter and tweet with us. And we look forward to having everybody join us digitally until we can get together again. And I bet even when we come to our new normal, we're all still going to be getting together on Zoom and digitally too, because you all have done such a great job of making community that way. So I'm just real thankful to Micheal, and a big welcome to Dr. Nichols. And I will see you next week. And until then, send me those stories. Thanks.
Great. Thank you so much, Selby. We will be sending out to everyone a five-minute survey. You'll be receiving it through email. We'd really ask, would you like to unmute yourself? I don't know what that means. I hope I'm not muted. I don't think I am. Can you guys hear me? Yeah, so there's something
I
that
hear
came
you
up.
Great, Reggie.
Yeah, there's
Fantastic.
something that came up on my screen, but I don't know what that is.
You've never sounded better, my friend.
We're going to send a 5-minute survey. If you can make sure that you answer it, it's going to ask questions about, give some feedback about this session, give you a chance to make comments, and about some other opportunities in the future for future webinars. As we go into next month, we're going to be looking at a couple of things. We're going to be looking at how do we support students and children as they go back to school. We'll be sending you some updated information about the webinar for next Wednesday. And we're going to do that for a couple of Wednesdays in August. And then talk about also how do we open up churches that as far as opening up when people are coming back from whatever vacations they were on or staycations. We'll talk about how do we do some of those things as people are returning from summer. So we look forward to meeting with everybody. Thank you so much for being a part. Micheal, thank you again. Selby and Tua and Craig, thank you. And we're going to keep our sessions open for a little bit so you can chat. And make sure you tell your friends to join us for the next webinar. Be a part of it. And if you want to get in touch with Micheal about senior, being a part of the senior movement here in the conference, just reach out to Micheal with seeing how we can do, what we can do to support our seniors and our elders in the conference. Okay, thanks to everybody. Have a wonderful evening. Yeah, we're still here. Somebody raised their hand, so I want to see what that's about.
Can you hear me?
Yes, we can. Judy, yes.
There are several of us in the audience that were listening, and we're members of the Beulah Fund.
Right.
Grant. When the Beulah Fund was closed, the retirement center funds came to the United Methodist Women. And for about 30, 40 years, we've been handing out grants to people that are enhancing the lives of seniors. People have Zoom classes, they have cancer, help for cancer patients. And I would like some of us to speak to you about that possibility of the grants that are coming up due in September. So I hope somebody else will speak up.
Hi, this is Selby, and thank you so much, Judy. I think Connie Weeks sent in a story that will be in the Instant Connection going out tomorrow around the Beulah Fund. So it's always synchronistic like this. So I was so glad to see the article come in and for it to coincide with Micheal's webinar. So folks should look for the Instant Connection, be in their mailboxes tomorrow afternoon.
Okay, well, thank you. Judy, would that be helpful? Judy?
Yes.
Cool. And I see Sharon, you had a question. Sharon?
Yes, I wanted to ask Selby. She has mentioned a couple of times through the webinar about letting the conference know what churches are doing to either celebrate or add to. And I would just like, how do we find that information? Where is it posted? Because it could be useful to other congregations to see what other people are doing.
That's perfect. And Sharon, could you just mention your question one more time? I live in Midtown and I think I had a sizable truck going by. So are you saying to celebrate? I got everything up to celebrate.
Well, I just would like to be able to have access to the site that you're talking about when somebody lets the conference knows what their church is doing to either.
Yes, so it's real simple. If you go to, and I'll put it in the chat.
Okay.
But it is the letters CNUMC. That's our California, Nevada website. And it's trying to autocorrect me. Here we go. I put it in all caps. And that's the conference website URL address. So if you type that in, you'll go to our homepage on the conference website. And if you scroll down on the right-hand side, you should see a red subscription form just down in the little column. It's not a full page. and you just enter your information, and you can subscribe not only to Instant Connection, but to many of the different publications we have. After the e-newsletter is released, all of the stories appear on our website under the News tab. So if you're on the home page, and you should go because there's a gorgeous picture of Bishop Minerva right on the front page. It's fantastic. So
Okay.
if you go, you'll see tabs upper right, and one of them is news. So you click that, and that'll take you over to our news page, and you'll see all of our news articles that have appeared, Lord, almost since the beginning of time. And so the most recent ones are the ones on the top. And so you just scroll down, and you might find some stories that you've missed, or you might find some things you want to follow up on. I'll also write my email address in the chat. And anyone that wants to, of course, you can send me stories directly. There is a way to submit it on a form through the website, and you'll see that on the news page. But heck, you can just reach out and email me. So I don't want to take up too much time, but thanks for asking, Sharon, and I'm here whenever you need me.
Okay, thank you very much.
You bet.
I'll see if there's some other questions. You can raise your hand by using the icon down the bottom. Raise your hand. And if you have some other questions, we're keeping the chat line open for a little bit, as long as I see that a lot of people are doing other things, and that's fine. But if there's some questions that you want to ask, we are going to hang around for a little bit. If you want to chat talk among each other, you can. I mean,
Yeah.
you chat among.
I just want to say to Mary, thank you. Fraud against elders is such a big deal, and so thank you for working with the police department and the district attorney as well to protect our seniors. And as you probably know, it happens mostly there are people, believe it or not, that look for obituaries, and they will go to a senior's home, particularly if the husband passed away, and say to the wife, your husband told me to come and fix the roof, and we had made arrangements, and so in order for me to continue that work, I need a check for this, or this. And so many of our widows and folks, because they're in a state of grief and everything, they think, oh, I have to write that check. Again, we're talking about baby boomers who don't like to owe, and that's why some of them get fraud. There's fraud just rampant in that kind of thing, and it's usually around house repairs. And so if you're working with any senior, just make sure you go through their bills and things, and make sure they're not being what we call double dipped for any one expense. That's really good. Thank you, Mary.
Is there a resource, Micheal, for tips that you have used that can help seniors? I know when my dad, before he passed, his computer was being blown up with stuff, and it's really crazy. Are there something that you might have used that are tips for that we can put in the resource space for watch out for this?
Legal aid for seniors is one of the, thank you, Dr. Nichols. Legal aid for seniors is the paramount program that has all of those things listed for fraud, any law, all of it. And Kevin Prindiville is the executive director. Go to their website and you will see all of those things. They have a whole section on fraud.
Good.
Yes.
I'm looking it up now, so
Yeah. Legal aid for seniors. Let me see if
Yep.
I can find it for you.
And we'll put,
Find it here.
we'll put some of those types of things in the chat, so that it can be codified.
Mm-hmm.
So,
Oh, I'm sorry, I gave you the wrong name.
Go ahead.
Justice and Aging.
Justice and Aging, got it.
Yes, sir.
Got it.
Perfect.
So some publications.
Yeah, he's got.
Yeah, I'm gonna put it in the web, yeah, cool.
Mm-hmm. And if I may put a shameless plug in for my podcast, which is Life is a Sacred Journey. And it's on Blog Talk Radio. And if you go, I'll send the link to Dr. Nichols. Actually, Selby has it. And we have a list, because we've done it now for 7 years, of all these aging topics. And you can pull it up and listen to the podcast where we have interviewed people from all over the world on different subjects around aging.
Cool. I pressed enter before I was entering, but there it is. Good. So,
It's so nice to see all the people come. This is such a good idea to have the fellowship kind of chat like fireside.
yeah. Well, as you know, as some of you that are remaining, it's, we're going to try to see how we can open up to see each other in the future meetings. We're going to see if we can make that work, because sometimes it's just good to see a face as opposed to just seeing a name or something like that. So we're going to see how that works.
It'll work. We'll make it work.
Good. And Selby put in Life is a Sacred Journey. Thank you, Selby.
Thanks, Selby.
Good. Any other things that are coming up, those that are still remaining? Any other things that, yep, Paul, yes, Paul. Yeah, Paul.
Hi.
Yeah.
Thank you. Micheal, I just wondered, you mentioned about the statistic about the seniors in the population, how many seniors will be of our population. I was wondering, in comparison, if you knew the figures for the United Methodist Church. I was just curious.
I don't know the figures for the United Methodist Church, but I think the last survey that we did as a conference, we found that the majority of, or over 50% of the folks that we serve in this conference are seniors. And I don't know if that still is true or not.
Yeah, I'm still relatively new.
Paul. That's a good question.
Yeah, I'm still relatively new, as you know, for the Methodist Church. So I was just curious what those.
Yeah, we'll look it up. It'll be good. It'll be a good research. I like looking up those kind of things. So we'll find that out, because that's a really interesting correlation. Are we seeing a growth in our, is it our aging community that is really the heartbeat of our conference, or is it something else? It's kind of, you start to ask those questions, not because you want to point finger at anything, it's just knowledge, and it helps us to create communication connection.
Thanks, Paul. We have a question from Bob and Leah. Yes, Bob. Yay. Sorry about that, Bob. I'll ask you to unmute. Go. Yes.
Okay.
Yes, sir. Good
All right.
morning.
It's coming through.
Yes.
With respect to the comment earlier made about tablets and using tablets, we've here in Trinity Methodist Church in Sunnyvale California, have gotten a couple of tablets, but we ran into a problem, and that was the internet access.
Mhm.
There is a solution for that. It's called a wireless access point modem, basically. What it does is connects to the same data source that your cell phone uses when you're doing data, the 4G LTE, and that gives you access to a radio method of communication that's much, cheaper, much broader also for people to use. The company that we used is called, excuse me, TechSoup, and they work in conjunction with a third company called Mobile Beacon. But I can provide URLs if people are interested in looking that up.
Bob, please.
Yeah, please do. Please do. If you could put it in the chat, Bob, we'd appreciate it, because the chat,
Right.
if any website, it will be saved in the recording. So if you can put the website for TechSoup and the other company that you mentioned, that would be very helpful, because that is a problem.
Right.
Even though seniors can get a discount on some of the services, it's helpful to know that and they could get them free. It's helpful to know who can help them.
Yeah, yeah.
Yeah.
Bob, thank you so much. That helps me quite a bit. I will share that with the Ombudsman group as well, because that's one of the major issues we're finding, because in a lot of the communities, they want to bundle the phone and the this and the that, and that makes the price go up, and people can't afford that.
Right. We have a gentleman who barely is able to pay for the space that he's living in and could not afford to buy or do the internet himself. And going this route, we're paying $15 for the modem through the donation program TechSoup offers, and $120 a year for the access to the network.
That's amazing.
Is cheap.
Yeah, brother, that is great.
So please put that in the.
Yep.
Please,
working on it.
Helpful.
Thanks, Bob.
Yep.
Well, everyone, we're winding down. I appreciate everybody hanging around a little bit. If this works, one person asked, will people's picture be up? No, you have to share your video. If you don't want to turn your video, we're good. We're not gonna photobomb you on Zoom, so we're good. But we appreciate everybody hanging around. If this is something you want to continue to see, just let us know. We'll put it in the chat. But we appreciate everybody being with us and hanging on for this Narthex moment. And we'll see everybody next week. All right. Thank you, and God bless you.
Peace and love, everybody. Bye-bye.
Bye.